Hello everyone, welcome to Larynx Academy, and today we are going to discuss on the practical session of larynx. So what is larynx? It's a part of our respiratory system. Where it is found? It is the part which is located between the C3 to C7 cervical vertebra. So in the respiratory system, the first part to receive the inspired air is our nose. After this, the air goes to the pharynx, and from the pharynx it goes to the larynx. So larynx is the third part of our upper respiratory tract, and it is the part which between the pharynx above and trachea below. So trachea is the part of our lower respiratory tract. So now when we talk about the larynx has three parts. The first part, that is the superior part above the vocal cord, is called as the supraglottis. The part between the vocal cord is the glottis, and below part between the vocal cord is the infraglottis. Our larynx can be viewed from various views. This is the anterior view as shown in the image you can see here right now. So when we see the larynx from the anterior side, what are the things we get? Superiorly we get the epiglottis in the center. Then we get the hyoid bone. After this we get a membrane called as the thiohyoid membrane. Then we get the first cartilage, the largest cartilage of the larynx, that is called as the thyroid cartilage. After the thyroid cartilage we get the cricothyroid ligament center, and the muscles we get the cricothyroid muscles. After this we get the second cartilage, that is a cricoid cartilage. So both the epiglottis is posteriorly, the thyroid cartilage is the largest cartilage which is present anteriorly, cricoid cartilage anteriorly, and then followed by the last part, that is the trachea. So trachea is the part of lower respiratory tract. After completion of the trachea, we are going to see the larynx from the superior view. So in the image you can see the larynx from the superior view. When we come to the larynx in the superior view, the point 1 indicates the hyoid bone. 1 is hyoid bone. 2 is the thyroid cartilage. So number 2 indicates the thyroid cartilage. Number 3 is our vocal cord, which is in closed condition. So when vocal cord is closed, it is helping in production of sound. The 4th is the adenoid cartilage. And after this we get the fifth number indicating the cornicuate cartilage, and above the 4 and 5 you can see this is the cuneiform cartilage. We also have the muscles like as the 6 number indicating the lateral muscle, 7 number indicating the transverse muscle, and 8 number indicating the oblique arytenoid muscle. So 6 lateral cricoarytenoid muscle, 7 transverse, and 8 oblique muscle. So from the superior view of the larynx, we can see the vocal cord. So what is vocal cord? Vocal cords are the two mucosal fold. And now you can see the vocal cord which is in an open condition. So when the vocal cord is open, it helps in air passage, and the closed condition of the vocal cord helps in the production of sound. So the space between the two vocal cord is called as the glottis. After covering the superior view, we are going to see the larynx from the posterior side. So when we see the larynx from the posterior side, we can see a muscle structure also, cartilaginous structure also. So coming to the after the epiglottis, we can see the epiglottic fold as marked in the image. Next we have the cuneiform tubercle. After this we have the cornicoid tubercle, and if we come to the muscles, we have the oblique arytenoid muscle and transverse arytenoid muscle. Near to that oppositely we have the cricoid cartilage, discussing on the figure as you can see here in the image. So let's have a look. One is posterior view. We have the epiglottis. It's an elastic cartilage. Second, we can see the thyroid cartilage. Third, if you see the cartilage portion, we can see the arytenoid. Followed below, we have the cricoid. So between the thyroid, epiglottis, and cricoid, we have the arytenoid cartilage. Next, the fifth number we can see here on the image indicates the tracheal cartilage. Sixth, we have the cuneiform cartilage. Seventh, cornicoid, and eighth is again the thyroid gland. So the muscles what we get: transverse arytenoid, oblique arytenoid, and post cricoarytenoid muscles. So that's all from the posterior view. We can see the larynx. Now after the posterior view, let's look the larynx from the mid sagittal section. So 1, we get the thyroid bone. 2, we will get the epiglottis. 3, we get the cuneiform cartilage. 4th, we have the thyroid cartilage. Number 5 is the cricoid arch. Number 6 is the cricoid cartilage. Number 7, we can see the tracheal. Number 8 is the vestibular fold, that is our false vocal cord. Number 9 is a true vocal cord. So these are the structures we can see in the mid section, that is a sagittal section of our larynx. So this is the image we can see clearly in the mid axial section. After this, the thyroid cartilage meet at a point. So the thyroid cartilage, both the thyroid cartilage meet anteriorly, and this is called as the Adam's apple or laryngeal prominence. So this is all about the larynx in the anatomical wise. Now when we talk about the surrounding boundaries of the larynx, the superiorly we have the tongue and the hyoid bone. Inferiorly we have it continues as a trachea. Laterally we have the thyroid glands and muscles of the neck. Posteriorly we have the laryngopharynx, C3 to C6 cervical vertebra, and anteriorly we have the soft tissues of the neck and the muscle. So this is all about the larynx. If you have liked the session, please like. Don't forget to subscribe our channel and share it to the people who require it for the anatomical purpose.